Composite bonding is a technique where we instantly improve the way that your smile looks. Having composite bonding at RUH Dental means you're going to see one of our highly trained and skilled clinicians, and it means that you're going to have composite bonding done freehand. Freehand means it's completely bespoke to your needs to fit your smile and fit your face. With your composite bonding, you're going to get a 12-month warranty and a free review appointment to make sure you love the way that it looks. For that, we charge £400 per tooth for composite bonding. When having composite bonding, you want to decide if you want it to be super natural or super done up, or somewhere in between. When you've decided, have that conversation with your dentist, and he can tell you whether or not you should have composite bonding or composite veneers. The main difference really is just how it looks. It's using the same material, but one can look super natural and one can look a bit more done up. So have a think and decide which you prefer. If you're watching this video, it's very likely you are a suitable candidate for composite bonding. Reasons may be: number one, teeth with chips in. They can be repaired instantly and really easily with composite bonding. Two, you could have gaps. These gaps can be closed super easy with composite bonding. Three, you could have been born with teeth which are an unusual shape, maybe super round or super small. They can be instantly improved with composite bonding. And the final things are stuff like white spots, yellow spots, brown spots. They can be covered quickly and easily with composite bonding to give your tooth a brighter and whiter look. To have composite bonding, your teeth don't need to be perfectly straight. If they're just slightly crossing over, one's a bit heavier than the other, we can often use composite bonding to camouflage that. So if you're not sure, just send us a picture, and everyone here is very skilled to see if you are a suitable candidate for it, and we can just tell you. When having composite bonding, it's super important to look after them, and there's only three things you really have to do. The first thing is see one of our dedicated hygienists every 6 months to keep them clean. The hygienists at RUH are very skilled in cleaning composite bonding, and if you see them, you know it's going to be looked after and cleaned properly. 2, use an electric toothbrush, and 3, using dental floss. Just those 3 things, and they'll last as long as possible and look good for as long as possible. They usually last between 5 and 10 years, and if you want to get up to those higher years, it's really important you follow those 3 steps as I mentioned. So before starting with your composite bonding, we will recommend that you whiten your teeth first. Really simple and easy process, takes 2 to 3 weeks. Once that's done, before we place the composite, we will check the colour of your teeth and then use a composite that matches the colour. And that means the composite bonding is going to match your existing teeth.